Everybody out there in NAMI, Tennessee land. I am super excited to be here. My name is Gabe Howard, and I am the host of the NAMI Tennessee at Home Facebook Live series. And we have an absolutely great show here for you today. First and foremost, I want to remind everybody to sign up for NAMI Tennessee's email list. It's just a easy lift over at namitn.org. And it reminds you about super cool things that we're doing. Things like this right here. I mean, who doesn't need reminded? Also, it would tell you all about the virtual NAMI Tennessee conference, September 23rd and 24th. Go over to namitn.org to register. We want to see everybody there. We have super cool speakers lined up. It's very awesome. I hope that you are there. All right, that's enough about that. Let's bring on our guest. Brittany Willis is here with us today. Brittany, welcome, and can you introduce yourself, please?
Sure. Thanks, Gabe. Hey, everybody. My name is Brittany Willis, and I am the Suicide Prevention Program Director at the Tennessee Department of Health. I work very closely with various stakeholders across the state to reduce suicide attempts and suicide deaths by identifying any gaps in mental health and suicide prevention services that may exist across Tennessee, and by helping to determine what support is still needed within local Tennessee communities. I also manage our comprehensive suicide prevention grant that we have through the Centers for Disease Control and Prevention. So thank you for having me here today.
Well, we are very excited for you. And it sounds like you know just an incredible amount about suicide prevention, suicidality, and you're definitely the person that we need to speak to so that we can educate ourselves and be in the correct position in case this happens to us, a loved one, a friend, or even notice symptoms in a stranger. So thank you for all of your education and for all that you do, and of course for being here with us.
Sure.
All right, well, let's start off. This is a big question, and I'm really curious about the answer myself. Is suicide considered a serious public health issue in the state of Tennessee?
So, unfortunately, suicide is considered a major public health issue in Tennessee. The total number of deaths by suicide has increased by 13% from 2015 to 2019, which is the most recent finalized data that we have for suicide death data here at the Department of Health. The rate of deaths by suicide increased in that same time period by 11%. And the 2019 rate of suicide in Tennessee is actually 29% higher than the national rate. And I also wanted to mention that we recently actually did get our 2020 vital statistic death data. So we haven't done much analysis of that data, but coincidentally in 2020, we lost the same number of Tennesseans to suicide as we did in 2019. So we lost 1,220 individuals to suicide in 2020 and 2019. However, the actual population of Tennessee increased by 81,666 individuals between the 2 years, causing a decrease in the rate of suicide for 2020. So the rate of suicide for 2020 is 17.7 per 100,000 in 2020 compared to 17.9 per 100,000 individuals in 2019. We do have, as I mentioned, a CDC grant, a comprehensive suicide prevention grant. We were lucky, we were one of 9 states awarded funding through the CDC, and we do have target populations for that. So we are focusing on rural residents because rural residents across Tennessee are unfortunately 1.4 times more likely to die by suicide. So we have a focus towards rural populations across our state.
This is sort of a weird follow-up question, but what numbers would we need to see for it not to be a public health issue?
So I would like to see that number dramatically decrease. Currently, as I said, we are 29% higher than the national rate. So we do have a ways to go. So I can't conceptualize a number to where I would feel comfortable in saying that it's not a serious public health issue in our state, but I can say that we do have a long way to go, but there are lots of resources and programs available to get us there.
Thank you so much for answering that question. All right, the next question that we have are, let's talk about prevention. I mean, obviously we can't prevent things if we don't know what we're looking for. What are some of the risk factors for suicide?
Yeah, sure. So, risk factors are defined as characteristics of a person or their environment that increases the likelihood that they will die by suicide. I think it's important to state that risk factors are associated with other things as well, such as cancer. So, we know that the risk factors for cancer are poor diet, lack of exercise, smoking, but we also know that those risk factors does not mean that that person will develop cancer. It just means that they're more likely to develop cancer. So that same idea is true to suicide. So though a person has risk factors for suicide does not necessarily mean that they will die by suicide, but it just means that they do have a higher risk for dying by suicide. So some of those risk factors include history of depression and other mental illnesses, a feeling of hopelessness or feelings of burdensomeness, substance use, misuse, or addiction issue, certain health conditions, so chronic pain or terminal illness, violence, victimization, and high conflict or violent relationships, so sexual violence and domestic violence, a sense of isolation and lack of social support, a family or loved one's history of suicide, of course, any type of financial or work stress, housing instability, inadequate community connectedness, barriers to quality healthcare and quality behavioral healthcare, as well as stigma associated with help seeking and mental illness. There's still an increased stigma of talking about mental health. And so that can contribute to the risk for suicide as well.
If somebody that we know or love, or even ourselves, has these risk factors, what can we do to help reduce those risk factors? And I know that's sort of a broad question since there are so many risk factors, but that's just it, right? It seems so incredibly overwhelming that somebody's like, oh no, I'm really worried about Brittany. What do they do?
Sure, yeah. So it's really important when you're thinking about risk factors to also consider personal protective factors in individuals' lives as well as their communities. So protective factors are personal or environmental characteristics that really help protect people from suicide. So when you increase protective factors, you really reduce the risk of suicide. So some of the protective factors that come to mind for me are cultural, religious beliefs or personal beliefs that discourage suicide, support through ongoing health and mental health care relationships, strong coping and problem solving skills, resilience, so personal qualities such as resilience, high self esteem, a direction or mission in life, determination or perseverance, reasons for living, so your parents, your children, your dog, your friends, connectedness to family, community, individuals, and social institutions, and of course, access to effective mental health care and encouragement in seeking help are also protective factors for suicide as well.
I think it's really powerful to point out that just by spending time with someone who has these risk factors, you're actually giving them a protective factor. And so many people think that it has to be something extraordinarily complicated, but even just saying, hey, you want to go to dinner, you want to go to lunch, and inviting them to a function, including them in a volunteer activity, even calling and talking to them on the phone for 15 minutes. These are all things that do reduce the risk factors for suicide. I don't want to call them simple, but they're not. We think about this in this huge way, and it's like, well, did you call them on the phone? Really?
Absolutely. And I think that that's a great thing to point out, Gabe, because protective factors can just really look like you being there for an individual who is struggling. So if you know someone who is going through a particularly hard event, taking that time to call them and say, hey, how are you doing? How are you holding up? Taking that time to safely, in a social distance manner, have lunch with them. Just being there for one another as a community, as a friend, as a family is really important and can really make a difference in the lives of someone who is struggling.
Thank you so much. Along the same vein, we're going to move into warning signs. You talked about the risk factors. Now let's talk about the warning signs of suicide.
Sure, yeah. So I think it's important to remember that death by suicide and attempts by suicide really and thoughts of suicide can affect anyone regardless of demographic characteristics. So no age group, ethnicity, or background is immune from suicide. Fortunately, many troubled individuals do display behaviors that deliberately or inadvertently signal their suicidal intent. And so recognizing these warning signs and learning what to do next may help save a life. So some of the warning signs for suicidal behavior includes talking about suicide, or just having a preconception to talk about death, and or just stating that they don't have a reason to live, a preoccupation with death and dying. Withdrawal from friends or social activities. So if you know someone who is really interested in a sport or interested in arts and crafts, and now all of a sudden they're not participating in those activities, that can be a warning sign for suicide. Experience of a recent severe loss, especially of a relationship or a threat of a significant loss, experience or fear of a situation or humiliation or failure, drastic changes in behavior, loss of interest in hobbies, previous history of suicide attempts, giving away prized possessions, loss of interest in personal appearance, increased use of alcohol or drugs, or general hopelessness could all be warning signs for suicide.
And it's important to point out that warning signs are just that. They're warning signs. They're not, it's 100%. You shouldn't walk up to somebody that has any of those signs and say, I know that you're planning, right? That's the wrong way to address it. But now let's talk about the right way. Somebody that you know has those warning signs. What's your next step?
Yeah, so I think it's important. Most individuals, or a high percentage of individuals, will consider suicide at some point in their life. The difference is that most everyone decides to live because they realize that that crisis is temporary, but death is not. So people in a crisis often perceive that their dilemma is inescapable and feel an utter loss of control. And so the biggest step in that is talking to that individual about how they're feeling and connecting them to the resources that we have readily available across our state.
Are there classes for this? And I believe we're going to get to this later, but I want to sort of, it's just a yes or no question at this point. We'll talk about it more in depth, but this is a big concept. Is there training classes and things like that available that we'll talk about later?
Yes, absolutely. So we are really fortunate across our state to have numerous free trainings available to really teach you an in-depth way to identify someone who may be experiencing suicidal thoughts or behavior, or maybe thinking about suicide, and how to connect them to help and resources. Yes, so we do have lots of trainings available.
I know we're going to go into this depth later, but as I was sitting there listening to it, I was like, wow, somebody could be watching this and thinking, okay, so it's hopeless. I mean, it sounds, how much training can you really get off of a 1 hour Facebook Live from NAMI, or even reading an article? So I wanted to ensure that people knew that Tennessee has your back. I also want to quickly drop in the National Suicide Prevention Lifeline and Crisis Text Line number, both very vital, both as something to hand out to somebody if you feel that maybe they're not giving you the right answers, et cetera. Just write it on a piece of paper and just say, hey, I really encourage you to call, or of course for yourself. I have these both in my phone, both in case I need them and to give out to other people. And it's very important to understand that you don't have to be on the brink before calling. You can call because you're trending that way. You feel bad. You're scared that you might end up that way. And Brittany, can you talk about that? Because I think there's this misconception that you have to be moments away from acting on suicide before either one of these is an option for you. And it's simply not the case.
Sure, yeah, and I think that that's a great point, Gabe. I think it's important to remember that if you're ever feeling like you can't stop the emotional pain that you're in, or that you can't think clearly, or can't make decisions clearly, or you don't see any way out, or you see a decrease in your sleeping patterns or your eating patterns, any of these things, please reach out for help, because that's the time you don't want to get to a crisis point before you talk to someone. There is help available out there. And so if you're feeling depressed or down or sad or anxious in any type of way, absolutely reach out to the many resources we have available. I know that the National Suicide Prevention Lifeline it is showing on the screen. We also have a really wonderful crisis response infrastructure across our state, and we have our own personal statewide crisis line. So it's 1-855-274-7471, and it provides access to trained telephone counselors 24 hours a day, 7 days a week, and it will connect you to the closest crisis center to where you're located. So if you're in the Northeast Tennessee, it'll connect you to those Northeast resources.
I'm popping that on the screen right now. I just, in the interest of typing quickly, I called it the Tennessee Crisis Hotline, and I hope that I spelled everything correctly. And just to verify, Brittany, it is 855-274-7471.
Yep. Mm-hmm.
And just for our out-of-state people, if they call, is this just for Tennessee?
So yeah, the out-of-state individuals will need to use the National Suicide Prevention Lifeline. Mm-hmm.
Perfect. So this is something for the state of Tennessee. But sincerely, we know this is available in multiple states. It's not available in every state, but there are crisis hotlines available in many states. So please Google it, and you might find one of your own. And of course, there is the national hotline that we had on the screen a few minutes ago. So Brittany, thank you so much for taking a moment to talk about that. I'll leave that on the screen just for a couple of more seconds while I locate the next question. All right. Oh, sorry. Go ahead.
And I also see that Aubrey had a question. Could we put Aubrey's question up on the screen so I can address that as well? She said, what do you recommend for those who may not have internet or phone access or people experiencing homelessness? So Aubrey, we do have several crisis walk-in centers and crisis stabilization units available across our state. You can find more information, including a statewide map through the Tennessee Department of Mental Health and Substance Abuse Services, and so I would suggest that being your first route. I hope that answers your question.
Wonderful. Thank you so much. And I noticed that LaDonna, I believe she is your coworker, popped that number on the screen for. I typed it rapidly for no reason, but the biggest reason that I wanted to put it on there is because it's 855-CRISIS-1, and that is much easier to remember than 855-274-7471. Also, it's available 24 hours a day, 365 days a year for anyone in Tennessee. So 855-CRISIS-1 is definitely something that we should remember. All right, here we go. I believe this is the next question. What are some of the current resources available to those living in Tennessee who may be at risk for suicide? Obviously, we just covered the crisis hotline, but I'm certain there's more.
Yeah, sure. So I think it's important to remember that effective suicide prevention is comprehensive and a multifaceted effort. So we're really trying to take a public health approach here at the Department of Health towards suicide prevention. Best practices in suicide prevention focus on suicide prevention strategies and activities such as promoting connectedness and resilience within communities, providing social support in communities to ensure individuals and families have necessities such as food and shelter, reducing that stigma surrounding mental health and suicide, teaching community members how to identify persons at risk for suicide and connecting them with appropriate referrals, increasing help-seeking behavior in individuals who are struggling, ensuring availability of adequate crisis care, ensuring appropriate care transitions are in place for those individuals who have attempted suicide or considered suicide, and then discussing means reduction strategies and access to lethal means with individuals who are considering suicide. So suicide prevention programs and services in Tennessee implement many of the strategies that I just talked about across diverse settings and agencies. We do have a list of all programs and services available across our state in our 2021 annual report. We also have a statewide suicide prevention mental health resource directory that will be released in the upcoming week, so be on the lookout for that. But you can find our report with a list of all programs and services available across our state at www.preventsuicidetn.com.
And I am typing that into the screen right now. It's www. Whoops, I hit the wrong button. www.preventsuicidetn.com. Suicide.
suicidality.com. And I also wanted to mention that we are constantly trying to improve suicide prevention programs and services across our state. I lead a statewide suicide prevention stakeholder task force team where we really look at any gaps that may exist and work together to learn how to merge those gaps. But we're also currently conducting a needs assessment survey in partnership with Centerstone Research Institute to help learn more about suicide prevention across the state and to help identify any gaps and services that exist for Tennesseans at risk for suicide. I know that LaDonna is available to pop that link in the chat box, and then if you wouldn't mind, Gabe, to copy that link and put it in, because we would love for as many people to participate in that survey as possible to help us learn how we can improve these programs and services across our state.
Absolutely. And there's the Tennessee Department of Health Suicide Prevention resources at Prevent Suicide TN. Is it .com or .org?
.com.
.com. Perfect. Okay. I get the orgs and the coms mixed up all the time, so I just assume that everybody else does, which is just wildly stupid. But I am who I am. Perfect. I will leave that up for a second while we locate the next question. Thank you so much. And remember, everybody, if you have any questions, please feel free to post them in the comments and we will pop them on the screen. And I know that LaDonna has popped in this. I know it's very, very long, obviously, if you're reading it off the screen, but it's in the comment section on NAMI Tennessee's Facebook page if you don't want to type all of that out. But hey, if you're able to type all of that out, I popped it right on the screen for you. So thank you so much. All right, let's head to the next question, which is the training question that I sort of alluded to earlier. What type of suicide prevention training resources are available across Tennessee?
Yeah, sure. So there are numerous suicide prevention training resources available across our state. And really the best part about these trainings is that they are all free. So if you are not familiar with the Tennessee Suicide Prevention Network, we are really fortunate in Tennessee to have an entire statewide organization that offers free suicide prevention training, resources, brochures, support, and materials. You can visit their website at www.tspn.org. They have regional directors that cover all 95 counties of Tennessee and offer these trainings. So some of the training opportunities that we have available across the state are QPR, so Question, Persuade, Refer, which teaches participants how to question someone whether or not they are suicidal, persuade them into receiving help, and then referring them to help. We also have assist trainings available, which are applied suicide intervention skills training, and that's a 2-day role play interactive training that really teaches more in-depth how to have more in-depth conversations and how to identify and support those at risk for suicide and really connect them to the resources within their communities. We also have Youth Mental Health First Aid, which teaches about mental health for youth and young adults across our state. We have the Columbia Suicide Severity Rating Scale training, which teaches participants how to use that screening tool to screen for suicide risk. We also have trainings for agencies and organizations wanting to implement the Zero Suicide Initiative. And then, another training that I'll highlight is TSPN does an adverse childhood experience training, which adverse childhood experiences are a risk factor for suicide. So the more that we can learn about, what adverse childhood experiences are and learn more about trauma-informed care, the better we can reduce risk of suicide across our state. We also have all this information available on our website that we shared earlier. And we currently also have a public service announcement available to share on YouTube, which really tries to increase training across our state as well. Gabe, would you mind playing that video?
I would absolutely love to play that video. Here we go.
More than 1,000 Tennesseans die by suicide every year. Warning signs include depression, anxiety, thoughts of suicide, and increased use of alcohol and drugs. These deaths are preventable. Learn how to recognize and respond to those who may be at risk. For information on free training, go to www.preventsuicidetn.com. you could save a life.
Wonderful. Thank you so much. Are there other resources? I don't mean to interrupt you.
Oh no, that's all that I wanted to highlight for this area. Thank you.
Beautiful. Thank you so much. We do have a couple of questions from the audience, and they're both about the impact of the suicide rate. They're very interested in the fact that they're not trending down. I mean, I guess they're trending down a little bit because of the increased population, but I believe you described them as somewhat plateauing. So I want to remind the audience of that information before the question pops up. But the question from the audience is, why are we not trending down? And if we just isolate suicidality in teenagers, is that section trending up or down? What about that breakout?
So I would say that the reason why, I don't like to say trending down or trending up. I still think that we have a long way to go to build resiliency and to identify and support those at risk for across our state. So I think the more that we can utilize the resources and programs and trainings that we have for free available across our state, and the more that we can reduce that stigma associated with mental health and suicide, encouraging conversations, discussing mental health and suicide, the better off that we can be and reducing those rates of suicide across our state. I think it's also important to have conversations about access to lethal means. So 61% of our suicide deaths in 2019 were caused by firearms. So having conversations about access to lethal means, safe storage, and you can find more information about safe storage and access to lethal means through the Suicide Prevention Resource Center or through Tennessee Suicide Prevention Network. As far as youth suicide, I would say that we have seen an increase in the number of youth experiencing suicide-related behavior, but we are taking a really active approach to that at the Department of Health. We do what is called suicide-related syndromic surveillance. So we do this weekly, and where we look at statewide individuals who are presenting to emergency departments for suicide-related behavior. So we look at visits that include suicide attempts, intentional self-harm, as well as those suicidal thoughts and feelings. And what we've done is we've created what is called a rapid prevention response plan in response to that surveillance. So what we do is every week we identify the regions and counties across the state seeing an increase in children under 17, and right now young adults 18 to 24. We will be expanding this across the lifespan. And then we send those alerts, is what we call them. So those areas that are seeing increase in suicide-related behavior, we send that to a number of individuals across the state that have an invested interest in mental health and suicide prevention. So individuals from Tennessee Suicide Prevention Network, Department of Mental Health and Substance Abuse Services, Centerstone, Jason Foundation, Blue Care Tennessee, Youth Villages, and I'm just naming a few. And what those individuals do is then disseminate that information, share our resources. And so we're really trying to take a real-time approach at responding to those increases in suicide-related behavior across our state. So I know that didn't directly answer the question, but I hope that provided more information about where we are as a state.
I know it's sort of difficult to say what's the long-term plan to reduce suicidality because, plans are big, thick. They involve many, many people, many, many agencies. Tennessee is a big state. So I don't know if there's a short version to that question, but what is the long-term outcome? What is the department doing to get these numbers down?
Yeah, so great question. We are, through our suicide-related syndromic surveillance, like I said, we will be expanding that across the lifespan. So we'll be looking at additional age groups, 25 to 44, 45 to 64, and 65 and over, and creating response plans for each of those age groups as well. Through our CDC grant, part of that grant is to have a 10% reduction in suicide morbidity and mortality, so that's suicide deaths and attempts, by 2025. And we have both community-based level prevention activities, healthcare-based prevention activities, and upstream prevention activities. So some of those activities include increasing access to behavioral health providers through telehealth sessions. So increasing the amount of behavioral health providers who are utilizing telehealth to offer services. We are also increasing the number of trainings that we have available across our state. We're also going to be implementing several new programs, one of which is the Good Behavior Game program, which teaches individuals in kindergarten through second grade how it's a classroom management activity that really teaches young people problem-solving skills, coping skills, and it really has great evidence that shows that it later in life has reduces suicide risk later in life.
Thank you so much. And I know that you've got a couple of minutes to answer a big question. So I want to reassure the audience, and obviously that's not all of it. The department is working on this very seriously and moving forward, and you should participate in that survey.
I will also highlight, if you're interested in learning or getting a closer look at more in-depth data, we do have in our annual report that I mentioned earlier on our website, our 2021 annual report, we look at it more in-depth data of suicide attempts, suicidal ideation, as well as our suicide-related syndromic surveillance and child fatality review data. We also, with our Suicide Prevention Stakeholder Task Force team, had developed 30 recommendations included in that report on how to improve suicide prevention services. And those recommendations are broken down by the organization most likely to implement. And so if you're interested in what you can do or what your organization that you work with can do to reduce the risk of suicide, you can look at those recommendations. There is a section for individuals, families, and friends and those recommendations as well.
Wonderful. Thank you so much. We have a couple of more questions from the audience before we move on, if that is all right. And they're largely about what may be increasing the suicide rate. And the first one is, how have opioids impacted the suicide rate? We're hearing a lot about the opioid epidemic. Is there a relationship there?
So the relationship is that substance use and misuse and addiction absolutely increases the risk of suicide. Many times individuals who are suffering from substance misuse and addiction also have coinciding either mental illness that is not being treated or suicidal thoughts and feelings that aren't being treated. So there is some intersectionality there. And we have lots of great trainings available in regards to opiates as well. I know that there's naloxone trainings available across the state, and you can visit Department of Mental Health and Substance Abuse Services for more information on that as well.
Wonderful. Thank you so much. And then again, along those same lines, we want to talk about the pandemic. Is the pandemic increasing suicide, the suicide rate, or plateauing it? Does it have any effect whatsoever?
So I think it's too early to tell about the pandemic. I think that one of the things that we are doing in response to the COVID-19 pandemic and have since March 2020 is we are creating a weekly report, and it's just really for internal leadership to really track this across the state. But we're looking at, in partnership with Department of Mental Health and Substance Abuse Services, as well as Tennessee Suicide Prevention Network. Monthly, we're looking at suicide deaths occurring, ED visits, crisis calls, as well as a text to the crisis text line to really see whether people are reaching out for help, whether our deaths are increasing across our state. I think it's just important to remember that folks are struggling right now. We're dealing with really unprecedented times. Everyone is in their own lives. And so I think that's just a healthy reminder that it's okay to not be okay, but know that you're not alone and know that there is help available. Encourage conversations that increase positive mental health and personal protective factors, and reach out for help if you're having those feelings that those really tough feelings and emotional pain that you just can't seem to go away.
Thank you so much. Staying along those same lines, what do we do I apologize. What should you do if someone tells you that they are thinking about suicide?
So I think having open, honest conversations about suicide is really, really important. I think the first thing that you can do is to not act shocked, and to show your support. So thank that person for opening up to you. If they have disclosed to you that they are thinking about suicide, if they have not disclosed, let them know that you're listening. So encourage conversations that help them open up more. Be direct if you suspect they're thinking about suicide. If they are saying things like, I just don't know if I can do this anymore, I just don't know if I can continue on, that is the time to really ask whether someone is thinking about dying by suicide. I think reassurance in these conversations is really important, and reassurance and the fact that you understand and that you care and that you're there for them. Reassure them that help is available and that these feelings are a signal that it's time to talk to a mental health professional. Really encourage treatment. I think it's important to remind individuals that individuals who suffer from depression or mental illness or thoughts of suicide are suffering from a disease. So the same way that we would encourage treatment for diabetes and encourage someone to go visit their endocrinologist and get treatment for diabetes, we really need to be having encouraging conversations with those that we see struggling mentally to access mental health help and get treatment for how they're feeling.
Thank you so much. The point that I want to sort of make sure that we get across is that it's okay to talk to somebody about suicide. There's a persistent myth that if you talk to somebody about it, you will give them the idea, or that you will encourage it, or that it will somehow become your fault. And of course, the data shows the exact opposite, that that people feel isolated and alone. And when you say nothing to them, that reinforces that lonely, isolated feeling versus just walking up and, like you said, having that frank and honest conversation. Can you talk on that for a moment? Because I do think that there are people out there who still believe that any talk of suicide is bad.
Yeah, sure. And this is going to be interesting because I like to give individuals a different perspective when we talk about this, because there is a lot of misconception that talking about suicide or asking someone about suicide will put the idea in their head, but that couldn't be farther from the truth. And a way that I kind of like to describe this is, I think we've all been, or hopefully most of us have been in a situation where someone tells us a juicy piece of information, right? So we call it gossip. And then that person follows that with, but please don't tell anyone. And if we're the good and honest people that I know that we all are, we don't tell anyone. We hold that secret within us. But what happens? It kind of eats at us, right? So we're like, we know the secret, we can't tell anyone. It's kind of driving us crazy. And then someone or the person that told us the secret comes and tells us, hey, you can share that information now. What happens? It comes spilling out of you. That's kind of how an individual who's experiencing suicidal thoughts and feelings feels. When you ask them about suicide, if they're already thinking about that those feelings are going to spill out of them, and if they're not thinking about it, it's not going to put the idea in their head. Another way that I like to think about this is, we all have money, or we all have bank accounts. So if I said to you all right now, will you give me all of the money in your bank accounts? You wouldn't. Just because I asked you about it, you're probably thinking, this crazy lady asking me to give you, give her your money. That's not going to happen. So just because I asked you to give me all of the money in your bank account doesn't mean that you are. So that same sentiment is true for suicide. Just because you ask someone whether or not they're thinking about suicide, if they're not thinking about suicide, it definitely is not going to put the idea in their head. So hopefully that helps individuals understand that concept a little bit better.
Thank you so much. I think it's important to cover because some of these misconceptions have been taught to us literally since we were born. It's not like we just made this up as an adult. This has been culturally put into us by, like you said about gossip, right? It gets repeated over and over again, and everybody's talking about it. Well, much like gossip, there's little truth to it, but it doesn't matter. It's juicy to discuss. And as you said, people aren't talking about suicide enough. So there's not enough chances to challenge that. So thank you for being here to challenge
Yeah,
it.
sure. I will also add that, the individuals who are impacted by suicide across our nation, across our state, are far larger than we actually think that it is. So we've already talked about some of the data points in Tennessee. So we know that in 2020, 1,220 individuals died by suicide in Tennessee. Well, research also shows that up to 135 individuals within a community can be impacted for every suicide death. So when we think about that, on the level of Tennessee, that's an astronomically large number of individuals in our state alone that have been directly impacted by suicide. So the more that we can encourage conversations about suicide, talk to one another, and learn that this is unfortunately more of a normal experience than we would like for it to be, the more likely that we can encourage individuals who are struggling to seek help.
Wonderful. Thank you so much. You're like your own Mythbuster. So that's very cool. We have another question that came in from the audience, and I thought it was a particularly good one. It said, what about law enforcement or certain careers that have higher rates of suicide? Is there any specific outreach to those groups?
That is such a great question. So there are certain occupations that have higher rates of suicide, law enforcement being one of them, correctional officers. Right now, I think one of the biggest populations that I'd like to highlight are our healthcare workers. Physicians and nurses already had a higher rate of suicide, and now with the pandemic, I can only imagine that is going to enhance our first responders. Tennessee Suicide Prevention Network actually has a first responder task force that really we're really looking at ways to improve suicide prevention for our first responders across our state, which includes law enforcement, fire, and EMS.
Thank you for reaching out to them. I know that we're sort of winding down on this, so if there are any questions, please put them in the chat right now. We don't want to miss anybody. So I know that Brittany will be happy to answer them, as you've answered all of the questions. So big round of applause. Thank you, Brittany. All right, the next question is, where can I go for more information on suicide prevention? Now, I know we've shared a lot of this throughout this episode, but break it down for us.
Yeah, sure. So you can visit the Tennessee Department of Health Suicide Prevention Program page at preventsuicidetn.com to find more about suicide prevention efforts in Tennessee and to get an in-depth look at 2015 to 2019 suicide-related data. You can also identify opportunities for prevention of deaths by suicide by reviewing those 30 specific recommendations on how to improve suicide prevention across Tennessee. On our website, we also have an infographic which highlights 2019 suicide death statistics, which is the latest full death data set that we have analyzed and finalized. We will have our 2020 infographic coming soon, and we will post that on our website as well. We also have an infographic which describes our work that we're doing around suicide-related syndromic surveillance. So you can find a lot of information on our website. You can also find regional information regarding free training, free materials, and brochures on other suicide prevention support by visiting Tennessee Suicide Prevention Network's page. Like I said, they have regional directors that cover all 95 counties across our state, and all of the services that they offer are free. So you can go to that website at www.tspn.org. And then, of course, we have Department of Mental Health and Substance Abuse Services has a lot of great programs available. And you can find a list of all programs and services available within that 2021 annual report that I mentioned earlier.
Oh, thank you so much. And a member of the audience took us up on a question. So thank you so much. The question from the audience is, what are your thoughts on keeping suicide deaths hush-hush in families and/or communities?
I think that is one of the most detrimental things that we can do. I think that stigma is a huge contributing factor to why we don't have as many conversations about mental health and suicide. And I understand, that suicide is a really, really difficult thing for families and communities to deal with. But that really highlights the need to talk about it more, because the more that we can encourage help-seeking behavior, the more likely that we can reach individuals who are struggling. So I think it's really, really important to share our stories, and let others know that there are people out there with lived experience. And I will say that we do have a survivor of suicide loss support groups available readily across our state, and I would really recommend those individuals taking part of those support groups as well.
Thank you so much. And Kyle was able to pop in a question as well. Why don't we say committed suicide anymore?
So that is a great question, Kyle. So we do not say committed suicide anymore because it really adds to that stigma. Actually, at one point in our national history, suicide was considered a sin. So if someone did die by suicide, that was considered a sin. And we also normally, when we use the word commit, it's usually an association with a crime, right? So that person commits murder or commits a crime. Those who are struggling with mental illness or struggling with thoughts of suicide are suffering from an illness, and they're not committing any type of act or crime. And so it's really important to remember that our language means something, and to really try to steer away from committed suicide and encourage more appropriate language such as died by suicide.
This is just sort of a follow-up question to that. Have you seen it help? There's lots of conversations about language and is it helping, is it not helping, or is it the PC police rearing their, et cetera. But you're in a position to see this firsthand. What have you seen with this language shift as far as in the faces of individuals who have experienced this in their own families, et cetera?
I think it makes an exceptional difference in the way that we approach this topic. So I know it is really painful and hurtful to use the language of commit, especially for survivors of suicide loss or for those who have lived experience. So I really do think that using appropriate language when thinking about mental health and suicide really has extreme benefits in helping to reduce the stigma associated with mental health and suicide, and to really encourage help-seeking behavior within those who are struggling.
Thank you so much. Thank you to everybody that asked questions. Before we get out of here, I want to tell everybody about all the cool things that NAMI Tennessee is doing. First, you'd already know if you'd sign up for NAMI Tennessee's email. This is very cool. It reminds you of all the cool events that we do, things like this every Monday at 2 Central, 3 Eastern. It's just NAMITN.org. Our virtual conference is coming up. We have so many cool speakers and tracks and information. It's all virtual, so anybody in the world can take it, but anybody anywhere in Tennessee, no travel, no mask required. It's Virtual NAMI Tennessee Conference, September 23rd and 24th. Learn more at NAMITN.org. Brittany, thank you so much for being here. Do you have any final words before we head on out?
I just would like to say, if you are struggling, if you are having feelings of emotional pain, or if you know of someone having those feelings, please don't hesitate to reach out for help. There are numerous resources available across our state. And as a reminder, you can visit the Department of Health Suicide Prevention Program webpage to access those resources at www.preventsuicidetn.com. And if you are in immediate need of help, please remember that if you are in Tennessee, you can access our Tennessee statewide crisis line at 1-855-274-7471. And thank you, Gabe, for having me.
Oh, you are very welcome. And we learned that crisis line, I'm doing the voiceover, you can't even see my face, but it's 855-CRISIS-1, very easy to remember. And again, that's only good in the state of Tennessee. I popped up all of the other addresses. So when this is over, you can just rewind about 2 minutes and you'll see them all again. And of course, they are in the comment section on NAMI TN's Facebook page, NAMI Tennessee's Facebook page. Thank you all so very much for everything. And Brittany, thank you so much for being here. We will see everybody next week.
Thank you. See ya.
Bye-bye.